This is Jessica Salmonson's session 4 review video for depression and anxiety. First of all, I really like this book, and I like the way that is designed. I like how it does the DSM-5 review of the diagnosis, and then it has a separate chapter for the treatment options. I really liked that layout until I took the test. It was very difficult flip-flopping back and forth between the sections, so I think maybe it would have been designed a little better if they'd put treatment closer to review. But nonetheless, very, very interesting two sections. Most of what I liked were the differential diagnosis options for both depression and anxiety. It did a great job helping to distinguish between grief and depression. I liked that it also differentiated depressive delusions versus schizophrenia, and I could see how that could be very easily confused. Depressive delusions have depressive themes like I'm worthless, I shouldn't go on, versus schizophrenia is very, very bizarre. I'm an alien from Mars type stuff. I also thought it was very interesting that ECT is considered the gold standard for depression. It seems like ECT kind of fell off the radar there for a while, and it's starting to reemerge as a potential treatment. Granted, very, very different from the way it began, but I find it fascinating. And considering that my sister is bipolar and has also been shown to help with bipolar, I'd like to know a lot more about that one. I also thought it was very interesting the differential diagnosis with bipolar, and that you really need to take that into consideration when you're looking at drugs as treatment options. However, I did attempt to go to bipolarhelpcenter.com as recommended in the book to get the worksheet to help distinguish bipolar from depression, and apparently the website's no longer in service. But it is on my to-do list to, in the future, maybe find a worksheet to help with that. As far as the anxiety section goes, I like the differential diagnosis with panic attacks versus anxiety, because when you have kind of a more mild, I want to say, form of anxiety, it can kind of it can be difficult to tell between panic attacks versus anxiety. And I don't mean general anxiety disorder, I mean more like an anxiety attack. I also thought it was interesting that there's 10 different types of anxiety. We tend to kind of lump them all together. And I found it was very interesting that the majority of people do not abuse anti-anxiety medications. Those that do have a family or a personal history of substance abuse, but the vast majority do not. So actually, I think it's probably a pretty safe bet for most people to try medication, at least in the short term, to get them through the tough times. I also found it interesting that anti-seizure medications work for anxiety and they're non-habit forming, so it's a safe alternative. And I thought it was interesting that as far as the anti-seizure medicines go, there's a 70% relapse rate for those who go off medication. So medication, once started, needs to be continued. And then online in Blackboard, it didn't ask us to go into OCD, but that was part of our reading assignment, so I'll go ahead and address it. There again, I thought it was very interesting that damage to the basal ganglia can cause OCD, that it's actually considered almost as common as anxiety or depression in the general populace, and that the treatment for it is similar to depression. Psychotropics are very effective, but once you start them, you can't stop the medications. As far as the treatment section goes, I thought it was interesting that MAOs are the last used for depression. I remember as a kid they were all over TV, advertisements everywhere, and so I think it's kind of interesting that now they've gone to the background and the SSRIs have moved forward. And I'd have to double check the dates, but I'm pretty sure it was in my lifetime that took effect. I also thought it was interesting that they use stimulants like Ritalin to treat depression. I'm not sure how I feel about that, and I think if I had depression, I wouldn't be real eager to try it personally. As far as anxiety, I learned that liver function is crucial. I think honestly, I err on the side of caution. I would counsel a client, whether they have an alcohol problem or not, I wouldn't go on a heavy night of partying while taking an anti-anxiety medication. I did look up the case that they referenced in the book regarding the girl who took Valium and then went out partying. She hadn't eaten for 2 days and slipped into a coma. I mean, I think there were a lot of factors involved in that case, and it was kind of the exception rather than the rule. But it was interesting that the combination caused her death. I also thought it was interesting that antihistamines can be used as an anti-anxiety. I've taken Benadryl on a few occasions. I don't recall any anti-anxiety properties, but maybe next time I'll try it. Found it interesting that they do not recommend prolonged use of anti-anxiety medications. I find this interesting because my dad has been on Xanax for 20 years, and he doesn't seem any different now than he did when I was a kid. So I'm kind of wondering, what pushes them to say that. Is that what kind of usage history would cause them to say that? Is it people who use it every day, multiple times a day? Is it the once in a while people? Is it just random? And I also found it interesting that getting off the medication, it's difficult to tell whether the withdrawal symptoms are causing anxiety or whether they're relapsing. And you have to be very, very careful as they're going off meds. And the book recommended extremely small dosage decreases to help people get off meds. So very interesting 3 chapters. I really like this book. I think it was a great choice for the class, and have a great weekend.